Box 46. I got a bit of a question real quick. I can't help but noticing whenever I go out, I see few people out. I notice that people are wearing masks. If they are doing anything, they are social distancing. I see that it's happening out there, but you keep saying that there's 40 to 50% social distancing. Where is that not happening? And by extension, what do you not qualify as abiding by the stay-at-home order? Because I know for me, I'm abiding by the stay-at-home order, but whenever I go out, I'm getting groceries, I'm having to do something work-related. What do you not qualify as that? So it's kind of a two-part question.
So I'll turn it over to Gibbie to talk to you about how the social distancing is actually measured. Then we can talk a little bit more about the stay-at-home order.
In the country right now, there are a number of measures that are being used to determine what the percentage of social distancing is in a community, and all we have is those things that are being measured, which includes how much people are traveling as compared to before the order went into place, what type of travel, those sorts of things that are able to be measured. But the other thing that I will speak to is the fact that it appears, so this is what I've observed is there are more cars on the road this week than there were last week. And if you look at the percentages of social distancing based on those metrics I was talking about, you are seeing an uptick in our lack of social distancing in the county. The other thing that we've seen is a number of, the stores are being very crowded. People are accessing the things that they want to do while they're at home, which I appreciate. But when the stores are incredibly crowded, then social distancing really is not being effective. So some of it's observation and some of it is actually metrics that are available. And these are Google metrics that are being measured countrywide.
Dina, this is Brett Jensen with WBT.
Oh, go ahead.
All right. Dina, I'm just curious, in terms of the parks, how much flack have you received about closing the parking lots, either from the county commissioners or residents, about closing the parking for parks?
So I'm sorry, I did not hear your question at all.
I'm sorry. Yeah, this is Brett Jensen with WBT. Just wondering if how much flack have you received from the county commissioners or residents about closing the parking in parks and stuff like that?
So the question is how much flack I've been receiving about the decision to close parks to vehicular traffic. Actually, from the board, I haven't received much pushback at all. I think that they understand what we're trying to accomplish in terms of trying to ensure social distancing and keeping people safe. I have gotten several emails from folks who are, not happy with the decision that we've made, but we made it really for a couple reasons. One, obviously, is to try to ensure that we have social distancing in our parks. The second is that in order for us to be able to enforce social distancing effectively in all of our parks, we would need the assistance of law enforcement to be able to do that. Our park rangers are not law enforcement, so they're not trained to do that. And before we actually closed the gates to vehicular traffic, we had instances in our parks where our park rangers were being verbally abused by patrons because that park rangers were trying to enforce social distancing. And so that is not a role that they are accustomed to playing, and I'm not comfortable putting them in that position. We don't have law enforcement be able to police all of our parks. Law enforcement is stretched very thin right now, and we don't have the resources between CMPD at the towns and the sheriff to be able to effectively police all of our parks. And finally, by putting our employees and law enforcement in our parks to enforce social distancing, we are putting them at risk for exposure, and we want to make sure that we limit that risk to our employees and to law enforcement. So it was really a multi-pronged approach to trying to enforce all that, and that's why we came up with that solution.
This is Chandler Moore. Quick question, clarification of deaths. So just earlier, 16 deaths online.
So I cannot hear your question at all.
Can you hear me now?
Yes, I can.
Quick question about deaths in the county. So earlier reported 16, but online it 15. So I'm just wondering about.
I'm sorry, you are breaking up and I still can't hear you. So can we go to the next questioner, please? Next question, please.
Hey, Dina, it's Allison Kuzmich from the Charlotte Observer. Can you hear me?
I can hear you.
Okay, can you go over the timeline for opening up the field hospital and the convention center as far as when you would expect the decision to be made, and if that field hospital is constructed, how long it would last, especially thinking about the RSC using that space?
Oh, okay. So you're asking about the timeline for opening a field hospital. I believe that was your question, Allison. We are still working. We are still working with the two hospital systems. They are really continuing to analyze how much capacity they can create within their four walls and how they would be able to staff that and obtain the necessary PPE, vents, and other supplies to be able to do that. And so they are looking internally first, and we expect to have a final decision from them within the next day about whether or not they want us to go forward with building that field hospital. And what we've told them is that, it takes 21 days to build a field hospital. And so if they think they're going to need it, we need to know because, our peak is expected to be sometime in mid-May. And so if we're going to peak in mid-May and they need those beds, we don't really have a lot of time to waste or wait for them to make that decision. And they're aware of that, which is why they're working very hard to try to determine whether or not they need those beds and if they do need them, when they'll need them. Next question, please.
Hi there, it's Hunter with WCNC. Can you hear me okay?
Yes, go ahead.
Hey there, Dina. I just wanted to ask, I know there have been several outbreaks in our nursing home communities. Is there a reason why we are not identifying those? And isn't it in the public interest to know where those outbreaks are happening as other states have listed?
Yeah, the question is about outbreaks in nursing homes and why we are not releasing information about where those are. And I'll ask Gibbie to answer that question.
So to date, we have had, I believe it's 6 outbreaks. Outbreaks in long-term care facilities are defined as 2 or more individuals, either staff or clients that reside in those facilities, testing positive for COVID-19. We have not had the need to release the particular names of those facilities at this point because we've been able to work with those facilities to contain the infection, the spread of it. We've been working with our long-term care facilities for 2 months now for them to restrict visitation. There's very limited access to those facilities, so they don't really pose much of a threat to the community at this point in time. If we were to have a large outbreak where we may have more concern about that, we might very well release that name. But at this point, if we released an outbreak, we're releasing the address of individuals, and that's not typically what we do in public health unless there is a public health need to do that. So until we run into a situation like that, we will not be releasing the names of those facilities. It's up to the facilities if they release those names, or if a family member decides to release it, we have no control over that.
Next question.
We've previously all that the more we social distance now, the better rate of compliance we get, the quicker we'll get through this. But now we're seeing a peak not hitting until June. So do you understand how some people may feel a little deflated seeing that the amount of time actually is extending, that we're going to have to live under these conditions? So I guess my question is, does social distancing actually help us get through this quicker?
I understand the concern that seeing those dates are creating for individuals. I mean, this is not the type of situation that most people want to find themselves in. Restricting people's freedom is not what we like to hear about. It's not what we like to have done to us as Americans. So I understand the issues that this creates for people. What we see with the flattening of the curve, it doesn't necessarily mean we're going to get out of this quicker. What it means is that we will see fewer positive individuals in our community at any given time throughout that curve. What that does is it buys our hospitals the opportunity, the time and the opportunity to be prepared to deal with those folks who most need their services. So without those kinds of spikes, the hospitals can take care of the numbers that we expect to see when the curve's flattened. If we don't flatten the curve and those numbers spike, then the hospitals could easily be overwhelmed. And so that's one of the main reasons for flattening the curve. And unfortunately, what it does is it pushes the timeline out, and that's what you're seeing right now.
How crucial is it?
Would you say?
I just want to add one more thing to Gibbie's comment. That doesn't mean that the stay-at-home order would remain in place as is until we pass the peak. It gives us the ability to look at the restrictions and have a plan to start to loosen some of those restrictions as we continue to see the curve flatten. So we don't want to give people the impression that because we won't peak until June that we're going to have the stay-at-home order in place as is until then, because we know that that's not realistic. But we have to look at the most effective way to start loosening the restrictions without letting the cases spike again. So that's kind of the balance that we have to strike, and those are conversations that we're starting to have.
Dina, as a follow-up, do you see the restrictions being lifted kind of like a dimmer in a gradual way, or a light switch where everything's just back to normal?
Well, so we know that we're going to be extending our order until April 29th to align with the governor's order. And it'll also have automatic extensions in there that will align with the governor if the governor chooses to extend his order. But we will continue to evaluate and see whether or not we can start to lift some restrictions, after April 29th. I don't see us doing that before April 29th because we still know that our peak is still a month away. But we'll continue to evaluate that. We'll continue to evaluate the steps that the governor's taking. I have conversations with my colleagues with large counties across the state about what actions they're taking. And so we're going to sort of take it week by week, and we'll make decisions accordingly. It's not going to be a situation, and I think you've heard this if you watch the national news, they're talking about this in the Northeast. It's not going to be that we're going to flip the switch and everything is going to be back to normal. There's going to have to be a phased approach to how we lift those restrictions and where we lift those restrictions.
Dina, it's Allison from The Observer. Could you clarify what lifting those restrictions would look like, what maybe initial phases would look like to get back to normal?
It's too soon to tell. It's too soon to tell how the restrictions would be lifted and in what manner. I mean, that is something that we would, obviously, Gibbie, from a public health perspective, would weigh in on, as well as the other experts that we talk to on a daily basis, to come up with a comprehensive approach on how to do that. We haven't really started those conversations yet, but we know that we need to start doing that.
Are there concerns that when you do start to lift restrictions that we will see a spike in it dependent on what you decide to do? How concerning is that?
The question is whether or not are we concerned if we lift the restrictions we'll start to see a spike. The answer is absolutely. And that's why, you have to really be balanced and measured in how you make those decisions. One of the things that we'd hate to see happen is that we lift restrictions, we see a spike, and we have to put them back in place. So again, it's going to be a slow, measured approach about how we lift those restrictions and what makes the most sense.
Hey, Dina, could you explain to me real quick? I'm sure I'm wrong on this, but did you have to extend the order to April 29th? Don't we automatically fall under the state guidelines by that?
So our order expired the 16th, but we have some items in our order that are a little bit more restrictive than what the governor has in his. So if we just let ours expire, then we would have defaulted back to the governor's order, which is a little bit less restrictive than ours. And we wanted to keep our restrictions in place and extend the time frame. Next question, please.
Dina, this is Courtney Davis with Spectrum News. I know that there's talks with the commissioners about other towns still staying with your, if you need to extend this farther. Is there concern that if they don't stay on board with you guys, that could lead to another spike from people moving around the county?
So the question was the role of the towns and the city and the county and how we go forward with the stay-at-home order. We're still kind of looking at, how that would impact things. We have been working very closely with the 6 towns in the city of Charlotte since we went forward with the stay-at-home order, and we have stayed in lockstep with each other as we went through this to make sure we could get consensus on next steps. So, like everybody else, the mayors are anxious to, I'm sure, get, their economies back up and running, and they don't want to harm small business. They do care about the public health side, and so we're trying to strike that balance. It would be very, very confusing if we had a stay-at-home order for the county, and then the city had one that was different, and the towns had one that was different. I mean, there's no way you could enforce anything like that. It would be very, very difficult. And so having consensus around that has been and will continue to be critically important for us.
I know in the last meeting you had noted, I believe I heard this correctly, some concerns about enforcement at our parks. Can you reiterate what that concern is? I know you said park rangers shouldn't be the ones enforcing this. In other words, is there something that needs to be done with CMPD or our sheriff's department to up enforcement?
So enforcement in the parks, what we saw initially when we had all of those folks in some of our parks, there was not a lot of social distancing going on. We had families that were allowing their children to play on the playground equipment, which was prohibited. We had, again, park rangers trying to enforce those guidelines, and quite frankly, they were being verbally abused by patrons when they were trying to do that. So if we are going to have people in our parks, we still want to maintain social distancing, and we need law enforcement to be able to do that. We can't rely on our park rangers to enforce those restrictions. And so because we don't have sufficient law enforcement to work in our parks, we're really trying to disperse as many people as we can to all of the parks in our community. And the way we do that is we don't allow vehicular traffic, which requires people to use the parks that are closest to their home and within walking distance from their house.
This is Derek with Fox 46. Again, another question in regards to something you mentioned last week. You said that 450 people had signed up statewide last week, and you mentioned that was not enough for just Mecklenburg County, just the county. You mentioned that 2,000 medical professionals have signed up as of today to come out of retirement. Is that going to be enough for Mecklenburg County?
So, and we're very excited about the fact that we've had over 2,000 people statewide. Now, that's not Mecklenburg, that's statewide, and I don't have the breakdown of who all that is, have put their credentials into the term system, and they are in the process of being vetted. For a 600-bed field hospital, we would need about 540 people to staff that. I think that's the number. I'd have to go back and check for sure. So if, potentially if all of those people were in Mecklenburg and they fit the credentials and what we needed, potentially that may be enough. But again, I think the hospital systems are looking across all of their venues, all of their sites to try to bring people in and retrain them from current jobs to do new jobs to try to be able to provide as much staff as they can internally. But we are continuing to urge people to put their credentials into the term system so that we have that capacity and can tap into that capacity if we need it.
Is somebody there with CMPD?
Yes. Deputy Chief Estes is here. Hold on.
Okay. Hey there, Deputy Chief. I just had a quick question. Could we get an update on if there have been any additional officers infected with COVID-19 or any additional in quarantine because of it?
Yeah, I think the question was, have you had any further CMPD officers who are infected or quarantined? So far I have 4 employees, 3 officers and 1 non-sworn member who have been confirmed. And of course we have those folks in the proper protocols. And then we have the same amount that we had before. We're in the 20 some odd to 30 range, and that changes daily based on people who have been in the protocol and who've come out. We take a very conservative approach with our employees as to when anyone feels ill or meets any kind of the symptoms of the matrix, then we go ahead and put them out so that we can ensure that we keep our workforce solid and safe.
This is Courtney Davis with Spectrum News. I was just wondering, how are we doing with social distancing, and are we going to get to a point of a checkpoint at all to make sure people are only out for the reasons that they should be and not going out unnecessarily?
I'm sorry, I couldn't hear the question.
She asked about enforcement of the stay-at-home order and whether or not they will be actually doing any checkpoints.
Say checkpoints? Yeah, no, at this time, there's no plans to do any roadway checkpoints to try to parse out who's essential, non-essential, that sort of thing.
Hey, Gibbie, I know that you said the new projection could be June 8th, but what are the concerns with that, specifically to this shortage of ICU beds and ventilators? It sounds like we're still in a pretty dire situation.
Well, the good news is that by flattening the wave, we have a little bit, the curve, we have a little bit longer to prepare for that. Our hospital systems are continuing to look at how they can increase bed capacity within their four walls, and also how they can change that bed capacity to meet that increased need for ICU beds. We're continuing to have conversations with the state about the need for ventilators, but we are also looking to other vendors across the country to bring ventilators in to the county to meet some of that additional need that we see. The other thing to remember is these are projections. This is a model that we have used thus far to make those projections. The numbers are volatile. They change every day, and we'll have to continue to watch those. But at this point in time, we feel like this has given us, the flattening of the curve has given us a little more time to be as prepared as we need to be. So we will keep you posted on how that works as we move forward, as we get further projections about that, how the hospitals are increasing their surge capacity within their four walls, and what other projections show as we move forward.
Hi, it's Claire Donnelly from WFAE. Can you hear me?
Yes.
Okay. So I'm wondering, talking about the modeling also, I noticed that you guys have us at more than 2,000 infections by April 25th. That would be like between 90 and 100 new infections a day, but Mecklenburg County has never had an increase of 90 or 100 infections a day.
That's correct. And that's...
Sorry, I meant like why does it say that?
Yeah, and again, I think the flattening of the curve has helped us with that. Our numbers have been low. Part of that really has to do with the amount of testing we're able to do in the county at this point in time. We are focused on making sure that we're testing those folks who have symptoms and are most at risk for serious conditions with COVID, in addition to our first responders and healthcare providers who may have been exposed. If we did a lot more testing, I think we would see those numbers that you're talking about. We just don't have the capacity to do that right now. The projections right now are anywhere from 25 to 60% of the population could potentially be infected. So, and basically either minimal symptoms or asymptomatic. As we learn more about this infection, that's what we're finding. So I think if we were able to do more testing, we would see the numbers that you're seeing in those projections.
What do you need to see happen in order for restrictions to be lifted, or at least start to be lifted?
I'm sorry, I didn't understand the question.
What do you need to see happen in order for restrictions to be lifted?
Well, I know there are a number of things that are being considered across the country around that. The one thing that you hear most is having sufficient testing in the community so you really know what is happening in your community. The second is significant contact tracing. We are continuing to do contact tracing in the county as much as we can. We're focused on the high-risk individuals with that effort. But with more testing and more positives, we would need to continue to ramp up our ability to do that. If we do that, then we have a better idea of what's going on in the community and can do a better job of isolating those folks who could potentially be spreading infection. Those would help us a lot in terms of really understanding our situation and recognizing how we can manage it better than we've been able to up to this point. Those are just a couple of examples. I think there will be more moving forward. A lot has to do with our hospital capacity and what the modeling shows us as we move forward.
Gibbie, this is Courtney Davis again. Will the county be coming out with recommendation on whether or not people should wear masks in public?
That's, obviously the whole issue of masks has been evolving over time, and we will be putting out some specific guidance tomorrow about masks in public. We want to make sure that people are using them appropriately and that they're taking care of the masks in the way that they need to. There's been some discussion about whether we should require masks. I don't think that we can do that because everybody won't have access. You can't require them to do something when they don't have access to it. But we will be putting that guidance out by tomorrow.
And one more question from me. Have universities or school districts reached out to you about whether it would be safe to reopen at all in the spring, later on or even in the fall? And if so, is there going to be like a partial plan or?
She asked if whether or not you've heard from the schools or universities about opening up and whether or not they've asked you about that.
No, we've not had any discussion about that at this point. I know that the schools are closed until the 15th of May, and the universities are closed for the rest of this semester. I know they're having discussions about what the fall would look like, but we have not had specific conversations about when or whether they should open again this spring. I recognize the fact that some of those conversations are happening at the state level with the governor and the Division of Public Instruction, as well as the Division of Health and Human Services, the Department of Health and Human Services. So we're waiting to see what kind of guidance comes from the state level on those things.
Ms. DiOrio, you mentioned a little bit ago during the meeting and also clarified, which I really appreciate too, about the Charlotte Convention Center possibly being used. It's the preferred site being used, at least at this point. We know you guys are looking for something that is near Uptown. So are you looking at, or is the Army Corps of Engineers looking at any other sites right now within Uptown potentially for this 600-bed field hospital facility?
My understanding is that they had looked at additional facilities in and around the Uptown area. So we're still waiting for a final decision, but one that is being considered is the Charlotte Convention Center.
Hey, Gibbie, I'm really curious. We've been at this for several weeks or months now. Knowing the state that we're in right now, what is the one thing that is keeping you up at night, the most concerning thing as you look forward?
Can I only pick one thing? We have a number of things that I think are challenging at this point in time. We are continuing to work with insufficient data. We're continuing to have to make decisions with insufficient data, and that's always troubling. We're doing the best we can with that. The other thing that does cause heartburn is the impact that this is having on our community, and that will continue to be a challenge as we move forward. We appreciate everything that everybody is doing. I see it every day, the work that folks are doing in our community to provide services to those who still need them, but also to protect themselves and to protect others. So we're very appreciative of that, and we recognize the hardship that this has placed on individuals and families in our community. So those are things that I think about in the evenings.
Okay, we'll take one more question, please.
Gibbie, in terms of the data, I'm glad you brought that up. Can you talk about just how early on, because you're saying there isn't a lot of good data out there yet or just insufficient data, how you guys are going about trying to make these decisions without having all the data? Are you using it from other cities, other states? How are you trying to assess all this data?
Well, obviously, we're putting out more data now than we were a month ago or even 2 weeks ago. So we are being able to work the data a little bit more than we were in the beginning. The more numbers you have, the easier it is to depend on that data. And we also look to other municipalities. There are a number of cities and states that are further ahead in the curve than we are, and we look to them, what they've learned, as well as what's happened in other countries. So we're pulling information from everywhere we can find it, including the different modeling that's taken place across the country and the different research and studies that are being done to try to make the best decisions.
Okay, thanks everybody.
Thank you.
Take care.